Hello guys, welcome back to Clinically Clear. So today let's cover two more important communicable diseases, that is tetanus and rabies. So tetanus, if you look at the epidemiological triad, the agent is Clostridium tetani, which is a gram-positive spore-forming drumstick-shaped bacteria. This is a bacterial disorder. The mode of transmission is soil, contact, or infected umbilical stump. This is especially for tetanus neonatorum or neonatal tetanus. Most common is soil. The reservoir is also soil. Very important, it has no human reservoir. There is no human to human transmission in tetanus. Very important. No human to human transmission in tetanus. The mode of transmission is soil and contact. The reservoir is also soil. The incubation period is variable. It can vary from few days to few months. Who will get it mostly? Think about it. It is the male farmers who commonly get injured, who are exposed to soil, and the neonates. Neonates when the umbilical stump is infected. Understood? Environment, unhygienic customs and practices where cow dung is applied on the umbilical stump. These all can lead to neonatal tetanus. So these are the environmental factors. Some customs and practices like unsafe delivery, rural delivery, applying cow dung on umbilical stump. These are all the environmental risk factors. Clinically, you have two important toxins, tetanospasmin and tetanolysin. Tetanospasmin, it blocks the release of presynaptic inhibitory neurotransmitter. So because inhibitory neurotransmitter is not getting released, there is unopposed muscle contraction leading to descending spastic paralysis, excessive muscle spasm leading to symptoms like lockjaw, trismus, opisthotonous position, rhizus sardonicus, etc. Tetanus neonatorum or neonatal tetanus, it is also known as 8th day disease, which has been eliminated now from India. So prevention, first of all, health promotion, health education. You have to educate them about hygiene, about safe deliveries, clean deliveries, wound care, etc., etc. Most important is immunization. Of course, you have passive immunization, that is tetanus immunoglobulin. 250 international units of tetanus immunoglobulin can give you immunity for 30 days. Understood? This is of course given intramuscular. Then active vaccine is the tetanus toxoid vaccine. Now toxoid vaccine under the NIS schedule, it is present in Pentavac 6 weeks, 10 weeks, 14 weeks. Then it is present in DPT 1.5 years, 5 years. And as TD it is given at 10 years, 16 years, and it is given 2 doses in pregnancy 4 weeks apart. So this is the NIS schedule of tetanus toxoid vaccination. But if they ask you what is TT schedule, that is post-trauma, or when you have to give tetanus later in life, this is for children and pregnant women. But later in adulthood also you can have trauma, still then also you need to get TT vaccination. That TT schedule is different. So you need mainly 2 primary doses, understood? I'm sorry, this is not mandatory. Yeah, these 2 are mandatory. So basically, the first primary dose and the second primary dose, which are 2 months apart, these 2 are absolutely mandatory. 1 year after the second dose, you can get a first booster, and 5 years after the first booster, you can get a second booster. This is the TT schedule, tetanus toxoid schedule. Very important. If they ask you what is the tetanus toxoid immunization schedule, this is the NIS schedule for children and pregnancy. But at 30 years old, at 40 years old, you get into a very severe traumatic accident or there is any trauma, then this is the schedule that you follow, the TT schedule. 1 dose and then 2 months later, second dose, which both of which are absolutely mandatory, and then the first booster after 1 year and the second booster 5 years later, that is optional. But these 2 are absolutely mandatory. This is the complete TT immunization schedule, toxoid vaccine schedule. Categorization of the immune status. This is not categorization of wounds, this is categorization of immune status, A, B, C and D. A is if someone who has received this complete schedule within the last 5 years, then all you need to do is wound care. Any trauma also, just give wound care, it is more than enough. If between 5 to 10 years ago, complete immunization between or a booster between 5 to 10 years ago, then you have to give wound care and a booster dose of TT. Understood? Because it was more than 5 years ago but less than 10 years ago. If it is more than 10 years ago, last vaccination or booster more than 10 years ago, then it depends on the wound. If it is a clean wound, then again wound care and a booster TT dose is enough. If it is an unclean wound, a dirty wound, then wound care, booster TT dose, 1 booster TT dose, and tetanus immunoglobulin, passive immunization has to be given. Understood? So category C, more than 10 years ago, clean wound, wound care, booster TT dose. That's all. Dirty wound, wound care, boost the TT dose, and a tetanus immunoglobulin passive immunization. Whereas category D is when the immunization status is unknown. This is common sense. Just give complete TT immunization. This whole immunization thing you will repeat again, not just a booster. Unknown status meaning complete TT immunization schedule. And if it is a dirty wound, you will add a tetanus immunoglobulin passive immunization. So tetanus immunoglobulin or passive immunization is only for category C and D when the wound is dirty, unclean wound. Okay, this is wound classification and immunization, active and passive immunization. How to prevent neonatal tetanus in specific? Through WHO clean delivery, 5 cleans: clean cut, clean tie, clean cord, clean hands, and clean surface. So this clean is achieved through something known as disposable delivery kits, which are given free of cost by the government of India. So what this disposable delivery kit contains? It contains a sterile blade, so clean cut. It contains a sterile thread, so clean tie. Sterile gauze, so clean cord. It has a soap bar, so clean hands. And there is a clean plastic sheet, so clean surface. So this disposable delivery kits contain all the equipment necessary for a clean delivery, where you have a clean cut, clean tie, clean cord, clean hands, and clean surface. This is specifically to prevent neonatal tetanus. Understood? And also neonatal tetanus, based on the incidence of neonatal tetanus, regions can be categorized into high risk, control, and elimination. High risk is when the incidence of neonatal tetanus is less than 1 per 1,000 and the vaccine coverage is less than 70%. Sorry, this should be ulta. I apologize. High risk is when the incidence is more than 1 per 1,000. High risk is when the incidence is more than 1 per 1,000. Vaccine coverage is less than 70%, and number of clean deliveries, percentage of clean deliveries is less than 50%. So this is when this region is high risk for neonatal tetanus. Control of neonatal tetanus is when the incidence is less than 1 per 1,000. Everything opposite. Less than 1 per 1,000, more than 70%, and more than 50% clean delivery, more than 70% vaccine coverage. Elimination of neonatal tetanus is when the incidence is less than 0.1 per 1,000, more than 90% vaccine coverage, and more than 75% clean delivery. India has eliminated neonatal tetanus 2015. India is free from neonatal tetanus 2015. Understood? So neonatal tetanus, you have clean delivery and categorization of regions. Otherwise, you have active immunization, passive immunization, categorization of immune status, and health promotion. Next, coming to rabies. Rabies, basically, you have agent factors, host factors, environment factors. Agent it is a bullet-shaped virus, rabies virus or Lyssa virus. Understood? The mode of transmission, bite from an infected animal, or aerosolization of rabies in labs, or corneal transplant. But most common, of course, is bite from infected animal. The reservoir is the rabid animals. The source could be the infected body fluids of these rabid animals is the reservoir. And incubation period depends on the type of virus. There is a fixed virus and there is a street virus. Fixed virus has a fixed incubation period of 6 days. Street virus has a variable incubation period, and the street virus is the one that causes rabies disease. Why is it variable? There are various factors that affect the incubation period. If it is a deep bite where there is a release of large amount of saliva on the wound, or if the bite is very close to the CNS, very close to the brain, like on the neck, on the arm, then, or if it is a wild animal bite with a very powerful bite force, then the incubation period reduces. Understood? So it has a variable incubation period, that is street virus. Fixed virus, fixed for 6 days, it is used to produce vaccines. Understood? Host factors, generally it is the males who get bitten more by all these because they are the ones who do adventurous stuff, stereotypically, right? And 1 to 20 year old, this is the age group that is generally outside behaving carelessly. So these are the host factors. And some occupations like forest officers, veterinarians, dog handlers, wildlife photographers, these are all some high risk occupations who are commonly exposed to infected animals, wild animals, and stuff like that. So these are the high risk occupations which acts as host factor for rabies. Understood? Prevention, most important, classify the wound or classify the bite. Class 1 low risk, class 2 moderate risk, class 3 high risk. Licks on intact skin, no problem. All you need to do is wound care. Licks or scratches where there is broken skin leading to abrasions, lacerations, where there are abrasions, laceration, broken skin, scratches leading to abrasion, laceration, then you need to give the anti-rabies vaccine and you need to give wound care. Class 3 is high risk when there is proper bite where there is oozing blood and deep tissue injury, or licks on mucosa. All this comes under class 3 high risk. Now many books keeps licks on mucosa as class 1. Some books say class 3 as licks on mucosa as class 3. Understood? Now wound care, and for class 3 high risk you have to give wound care. Of course you have to give rabies vaccine and you have to give passive immunization, that is rabies immunoglobulin. Understood? 1, 2, 3. 1 is intact skin, 2 is oozing, broken skin, abrasion, laceration, 3 is bites and oozing blood. 1 meaning wound care, 2 meaning add a vaccine to it, 3 meaning you have to give vaccine and immunoglobulin. What is the wound care like? Wash with soap and running water for 15 to 20 minutes. Continuously wash it for 15 to 20 minutes in running water and soap. Put antiseptics, put povidone iodine. Do not suture the bite wound, because this can facilitate the entry of the rabies virus from the skin where it has been deposited into the body. Understood? So do not suture the wound when it comes to rabies, or you need to do delayed suturing, which is after 24 hours. Understood? Passive immunization is rabies immunoglobulin, which can be equine, horse, or it can be human. Human meaning 20 international units per kg, horse meaning 40 international units per kg. Human is of course safer and it is more effective. Rabies immunoglobulin, it is only given once in a lifetime and only for post-exposure prophylaxis. Pre-exposure prophylaxis, re-exposure prophylaxis is not given. Once in lifetime after post-exposure prophylaxis, if it is class 3 or class 2, usually I told you class 2 we only give vaccine, but class 2 when the patient is immunocompromised, then we still have to give passive immunization, rabies immunoglobulin. So once in a lifetime for post-exposure prophylaxis, only for class 3 and for class 2 wounds. Okay. Now anti-rabies vaccine mainly are of two types. Varicocele culture vaccine and human diploid cell vaccine are the ones that are commonly used nowadays. Both are killed vaccines, freeze-dried killed vaccine. Okay. Now you have post-exposure prophylaxis, pre-exposure prophylaxis and re-exposure prophylaxis. Post-exposure, now vaccines can be intramuscular, 2.5 international units, or intradermal, 0.1 ml. Okay, now if it is intramuscular, the regime is you will go 5 times. Day 0, day 3, day 7, day 14 and day 28. And each visit you will get 1 dose of intramuscular vaccine. Understood? This is known as the SN regime. SN regime. Intradermal, you will go 4 times. Day 0, day 3, day 7, not on day 14, and it will go on day 28. Where each visit you will take 2 doses of intradermal vaccine. This is very important. Many people miss out on this. It is 4 times you will go for intradermal. According to Thai Red Cross regime, modified, updated Thai Red Cross regime, but you will go 4 times, but you will take 2 doses each time of intradermal. Okay, so totally 8 doses of intradermal. Understood? SN regime, 5 intramuscular doses, 0, 3, 7, 14, 28, 2.5 international units. Intradermal is 0, 3, 7, 28, 4 visits, 0.1 ml, 2 doses each time, which is Thai Red Cross regime. Anti-rabies vaccination, even if the dog which has bitten you has been a vaccinated dog, it is a domestic dog, still you have to take the vaccine, but the only contraindication is anaphylactic reaction. Otherwise, there is no contraindication for anti-rabies vaccine. Okay, this is post-exposure prophylaxis. What is the exposure? Wild animal bite or dog bite. Pre-exposure prophylaxis. Example, if you're traveling to an area which is endemic, high amount of rabies cases, lot of rabid dogs, rabid wild animals, or if your job is high-risk job, I told you, forest officers, veterinarians, and dog handlers, wildlife photographers, then you'll take 3 visits, pre-exposure, in either intramuscular or intradermal. You won't take both, either intramuscular or intradermal on day 0, day 7, which is 1 week, day 28, which is 1 month. So first day, then 1 week later, and then 1 month later, 3 visits, pre-exposure vaccination. Understood? Either intramuscular or intradermal. What is re-exposure prophylaxis? Now this also either intramuscular, intradermal, 2 visits, 2 doses on day 0 and day 3. Let's say I either got a pre-exposure prophylaxis or I took a post-exposure prophylaxis and it has been more than 3 months. Again I got bitten. Okay. Again I got bitten by a wild animal or got bitten by a dog. Then I'll go for a re-exposure prophylaxis. If a vaccination has been given more than 3 months ago, that vaccination can be a pre-exposure prophylaxis or it can be a post-exposure prophylaxis. But if it's more than 3 months ago, you have to take re-exposure prophylaxis on day 0 and day 3. Understood? So in rabies, you have the anti-rabies vaccine, active immunization, passive immunization, wound care and wound classification. Thank you for watching.